Hello, beautiful people. Today is March 17th. Happy St. Patrick's Day. Let's see, let's just jump right in. Do you believe we should sell defense articles and services to Israel? House Joint Resolution 71, providing for congressional disapproval of the proposed foreign military sale to Israel of certain defense articles and services. This came from Rashida Tlaib, who's a Democrat out of Michigan. This is one that probably went to committee floor to die because the Republicans are currently in charge of the House and Senate, and so they are not going to do this. They prefer to help Israel bomb the heck out of Palestine. And those of us who don't want to see more bombing in Palestine, we're not anti-Semites. We don't hate Jews. We don't think Jews are bad people. We just don't want to see all the death and destruction. And it's just ridiculous. Oh, and we also don't want to see our country spend money to build up Palestine. Donald Trump. Just don't want to see it. We don't want to see it. Can we help rural hospitals to get discounted drugs? HR 44, Rural 340B Access Act of 2025, that's its short name, to amend Title III of the Public Health Service Act to include rural emergency hospitals in the definition of a covered entity for purposes of the 340B drug discount program. This was brought to us by Jack Bergman, who's a Republican out of Michigan. So, Section 2 says including rural emergency hospitals as covered entities for purposes of the 340B discount program. I'm surprised this bill even needs to exist. Why would they not be included in the first place? So this bill makes rural emergency hospitals eligible to purchase drugs from manufacturers at discounted prices by participating in the Health Resource and Service Administration's 340B drug pricing program. HRSA's 340B program requires drug manufacturers that participate in the Medicaid program to sell certain outpatient drugs at discounted prices to entities listed as eligible under current law. Additionally, in 2020, Congress established REHs as a new Medicare provider designation for hospitals in rural areas providing emergency department services, observation care, and other outpatient medical and health services for which the annual per patient average length of stay does not exceed 24 hours. The bill adds qualifying REHs to the list of entities that are eligible to participate. This is absolutely fantastic. I love the idea. But if you defund Medicaid and Medicare, these same hospitals will go out of business. It's a moot point. This bill is just for show. I don't believe its legitimacy at all. So while you're watching this video, please like, subscribe, share. Knowledge is power, and we can all use more knowledge about what our Congress is doing. Thank you. So next question is, should we give medical care to lower income children permanently? HR 1901, to amend Title 21 of the Social Security Act to permanently extend the Children's Health Insurance Program and for other purposes. This came to us from Nanette Diaz Berrigan, from a Democrat out of California. So I have, in the past, had to consider healthcare into what jobs I worked. If I make too much money, I would lose mine and my children's health care. However, if I make enough more, would I make enough more to cover the health care I now have to pay for? If I took a job where I ended up taking home less money, it would be detrimental to my family. Many people in this country have to make those decisions every day. The CHIP program is a bridge for those people who can't, they don't make enough to get Medicaid, but they make too much. They make too much to get Medicaid. They don't make enough to pay for their own health insurance without having to go hungry. So I'm, yeah. How should the mental health of public safety officers be treated? Public safety officers have one of the hardest jobs. So this bill, H.R. 1902, to require the Secretary of Health and Human Services to improve the detection, prevention, and treatment of mental health issues among public safety officers and for other purposes. This is brought to us by Amy Vera, who's a Democrat out of California. Public safety officers have an extremely stressful job, and a lot of the time they're seeing people on their worst day of their lives. I absolutely believe if someone's at risk for having a mental health break, they need treatment, no matter what job they have. I do have a problem with a blanket exclusion of people with mental health illnesses for this position. I just have to tell you, I knew someone who applied for a public safety position who had a mental health disorder. They provided their mental health records during the whole application process. The person's record showed almost 10 years of medication compliance, of stability, excellent understanding of their triggers, their symptoms, and ways to stop episodes before they happen. It didn't matter because anyone with this disorder, no matter what, was excluded. The problem with this is they passed up a possibly excellent employee who they knew was stable for people who may have a disorder that hasn't yet been diagnosed. The other problem is the stigma, especially in the public safety field. They don't want to get help because it can be seen as weak or can reflect poorly on their job performance, even if it can be controlled. I'll update you on this one when I get the text. I look forward to seeing you for the next video. Thanks for watching and have a day that matters.